Hello, everyone, and welcome to today's webinar, 4 Creative Cost Strategies that are Changing Healthcare for Good. My name is Andy Mullins. I'm the Senior Marketing Manager with Paladina Health, and I'll be your moderator today. Before we get underway, I'd like to let our presenters do a quick introduction and give you a little background about themselves. JP, let's start with you.
Thanks. My name is JP Miller. I'm Senior Vice President of Sales for Activate Healthcare, located in the Cincinnati area. I've been in the healthcare field for about 12 years now. Been with Activate for the last 4 years, and prior to that was on the carrier side of the business with Humana for 8 years in various roles throughout the sales organization. So, thanks.
Great. Thanks, JP. Glad to have you here. Kim, how about you?
Sure. Thanks, Andy. I'm a Senior Account Manager for Paladina Health. I'm located in Denver in the corporate office. I've got 23 years in the industry. I began in specialty physician billing and management, went into carrier provider relations and risk contracting, and then entered sales and service for a carrier, and I'm now at Paladina. Very happy to be here. Thanks for the invitation.
Thanks. Glad to have you, Kim. Tony, would you mind doing a quick introduction?
Sure, thanks. I'm Tony Perkey. I am a healthcare consultant with Aon, a global consulting firm. I have my background as healthcare administration. I used to run physician practices for a large independent group and then a hospital. And transitioned over to the employer space for a manufacturing firm and started doing clinics about 5 years ago, and then transitioned into consulting about 3 years ago. So thanks for having me.
Great. Glad to have you here. Thanks so much. Well, we'd love to hear audience feedback. So at the end of this webinar, we'll be sending out an email where you can reach out with any questions you might have. And we also encourage you to share the webinar with colleagues across your social channels using the hashtag #ChangingHealthcareForGood. So before we dive into the webinar, let's take a look at the biggest healthcare challenges facing employers today. 1, rising healthcare costs. 2, shifting reform regulations and changes in the industry. And 3, population health and data utilization. So our agenda for today is going to be broken into 2 parts. First, we'll talk a bit about how employers overcome these challenges, specifically focusing on funding models, personalized care, better access to healthcare services, and population health and data utilization. In the second part of the webinar, we'll talk a little bit about what the experts have to say. So what do employers really want? What are the most cost-conscious benefit offerings? And what does the future of healthcare look like? So what are the biggest healthcare challenges today? In 2017, total US health expenditures reached $3.5 trillion. Tony, can you give us your perspective on that?
Yeah, so, we all know that the current healthcare system is unsustainable. The costs just keep rising and rising, averaging 6 to 8% increase year over year. And the outcomes really just haven't shown improvement. Quality has not gotten better. There's certainly been no real value to what we're in. We're in a fee-for-service model where it's all about volume, and the industry has not been able to adapt and change.
JP, what do some of the statistics say?
Well, if you look, going back 20 plus years to the early 2000s, the cost of providing health coverage to a family has gone up steadily each and every year, with maybe a few exceptions along the way where it maybe has plateaued off a little bit, only to then continue to go up. And what has happened is more and more of that cost burden has been shifted to the employees. And so that presents a whole set of other challenges relative to people feeling comfortable getting health care, whether they can afford it, and people putting off care that they need because it's too expensive. And so it's, as Tony said, the sustainability of the healthcare system and where the costs are going today is certainly in question when it comes to employers providing private healthcare to their populations.
I think so much of our expenditure in this country is reactive and acute care, so very little of it is prevention. And so based on this fee-for-service sort of I get paid when I see people. It really is just sort of this cyclical thing. People avoid care because they have more risk and more cost share, and things go longer, and then we get into this cycle of, okay, now we're in an expenditure because lack of prevention or maintenance.
Well, that's exactly what we're here to talk about today. So how do employers overcome these challenges? So up to 90% of employees' healthcare needs can be met while minimizing costs. Kim, what are your thoughts on that and how that can be achieved?
So yeah, I think moving away from the fee-for-service model, and by that I mean doctors seeing a patient, and that's really the only way they get paid. So they're incentivized to see the patient face-to-face. So I would say rather than billing for each of these, because the incentives aren't really aligned to truly taking care of their patient at the time that they need care, especially in the primary care setting, would be to do it sort of a flat fee and a fixed monthly per member per month that includes all care. So you remove the access of really the cost barrier and access.
JP, how does it work in the Activate healthcare model?
Yeah, it's very similar to what Kim described. We're contracting directly with the employer and sitting outside of the health insurance plan. So we're no longer submitting claims to the carrier for reimbursement. And so it's a cost plus arrangement where we determine what the cost would be to operate the clinic, including all of the staffing, all of the technology, medical supplies, overhead support, plus our management fee, to come up with a monthly rate that the employer pays directly to Activate, and we provide all of the service that's needed for that employer. So it takes the patient out of the equation in terms of having to come up with money each time they have a visit. These visits are no out-of-pocket costs in many instances for these employees. There are some HSA considerations for some groups, but generally speaking, you remove the cost barrier from the employee, which encourages them to get care. And at that point, it's up to us to drive utilization into the clinic so that it's a winning proposition for the organization, and we can save them money.
That's great. I'm excited to learn a little bit more and talk more about that throughout the webinar. Tony, you come from a really unique role at Aon. Can you tell us a little bit just about your role and how that came to be, kind of in light of funding models?
In the past at Aon, most of my team is H&B consulting, so benefits consulting. But there's only so much you can do with plan design. We've tried to shift everything more to the patient so that they would take more accountability, as JP said. But it's just not really happening. So now employers are saying, okay, what do we do next? How do we get innovative? And one of those ways is to do direct primary care or on-site, near-site clinics. And Aon recognized that early on and said, we need somebody from the healthcare industry that understands traditional healthcare. And so they brought me on board.
Great. JP, I'm interested, what are some of the stats that Activate is able to provide or present through the sales process, specifically around the minimization of cost?
Yeah, when we look across our book of business, on average, we're getting $1.50 to $1.60 return on investment for every dollar invested in the clinic. So that's one of the main drivers that we sell to our prospects, and we do a financial projection and model out potential ROI for each one of the groups that we work with. But in order to get that ROI, you have to get participation and utilization in the clinic. And I think the biggest differentiator that I like to speak about is our utilization rates. We look at unique participation in the clinic. So unique individuals within the population that are engaging with the clinic within the first 12 months of the clinic opening. And we're averaging for the employees around 85% unique employee participation within the first year. Spouses around 50 to 60%, and probably around 30% for the dependent children. So the more that you can drive people to the clinic and get engaged in their primary care and get working with a provider, the greater effect that's going to have in terms of ROI.
That's great. Obviously, really important that we save money across the healthcare spectrum. But Kim, I'm interested too in just touching on what's the patient sentiment and how does cost really translate to the patient experience?
The direct primary care model is so refreshing that people can actually get in same or next day, and I can talk to my doctor and he'll help treat me over the phone. And so it's really like this paradigm shifting moment for them when they realize that this is totally different and this is going to be better. And then there's the cost savings on top of that. So for me, I hear resoundingly, it's not just that I'm going to save money. It's like, oh my gosh, I can actually see a doctor. I can actually talk to a doctor same day, next day, and longer than 5 minutes, 10 minutes. Yeah. So I love to be able to help people to see something different, and we really have some amazing outcomes because physicians are just spending time with patients.
Yeah. It's phenomenal. I think ultimately it sounds like all of this serves to facilitate better care that's really based on somebody getting the access they need and getting it at a lower cost. That's fantastic. I think second, we want to touch a little bit on personalized care. And so there's a growing demand for innovative solutions that offer exactly that, personalized care. But what exactly do we mean by personalized? And as we know, a one-size-fits-all approach to healthcare really isn't working. It's not addressing chronic conditions. It's not helping provide preventive care, and it's too costly. So, Kim, I'm really interested in your perspective on what people need and what they really want in the personalized care space.
I think, sort of to echo my prior commentary, like we're at a point where people don't even really understand or remember like what high quality care looks like. And the DPC model certainly does that. But demand, I would say access. We're all very busy. When we're sick, we need help. I can see my doctor. It doesn't cost me as much money. And I'm actually able to work on a plan to better my health with my physician. It's groundbreaking and very paradigm shifting.
Yeah, that's wonderful. JP, can you tell me a little bit about Activate's model and really specifically care coordination? I think that's a big piece of providing personalized care. I'm just interested how that works in your model.
Yeah, so like Paladina, we are a physician-based approach. Wherever it makes any kind of sense financially to have a physician lead the clinic, that's what we recommend. And the reason we do that is we want the primary care physician to be the quarterback of care for the patients that we serve. And so in the healthcare system today, it's very fragmented. People could be working with multiple providers across the healthcare system, and none of it's being coordinated by one central provider or quarterback of care. And so within the Activate model, we want to be the partner with the patient in terms of every referral that gets made, kind of co-managing those specialty treatment plans alongside the specialist, and being that single place of care, medical home type approach for our patients to help them navigate the system, make it less fragmented, and focus on them as the patient, and help put all the pieces of the puzzle together to get to the root cause of what is causing a particular condition, and not simply just treat the symptoms and move on. So it's about putting the patient in the middle of the equation instead of fragmenting them out across the whole system.
Yeah, appreciate your perspective there. So Tony, so far we've talked a little bit just about funding and personalized care, and it seems like a win-win, right? I'm interested in your perspective coming from kind of the consulting side on whether or not this is an easy sell. Does this make sense to the people that you're interacting with on a daily basis?
Yeah, generally it is. To JP's point, there's different size companies and models, and so you have to dig into the details to figure out which model works best for your situation. But generally, there is an easy sell at some point. You decide what model that is, and that really just becomes because it's the simplicity is you have bundled packages of pricing. The fee services, the fee schedule is very basic. An office visit costs this, or everything's included. There's not all of these smoke and mirrors on pricing. And then, as Kim said earlier, it's not a 5 or 10 minute visit. So you get to come in and actually see your doctor. You don't have to wait all day to get into your doctor. You get to spend 20, 30, even 40, 45 minutes with your provider, getting to the root cause of your healthcare. So it really is a no-brainer most of the time, as long as you can, show the financial value to an employer.
Yeah, that's great. So one of the third solutions we've talked about, and I think you guys have touched on this a little bit, is just better access. So we know that lack of time, access, and money are the main reasons employees don't get the care they need. Kim, can you tell us some of the specific benefits that people have through this type of employer-sponsored program that facilitates better access?
I would say the DPC model and the Paladina model specifically, I'm sure Activate does this as well, that you don't have to just come in and be seen face to face. So you have access to your provider via telephone, via email, digital correspondence. We have the convenience of like when you actually go and see the physician, say for an acute need, you can leave the clinic with the prescriptions. So we have about 50 prescriptions that we keep in generic form on site. We really, from beginning to end, whether it's face-to-face or virtually, diagnose them, help them, and get them the medications that they need.
That's great. So Tony, how are you seeing this in other areas, right? So some of these I'll call them value adds across the fee-for-service world, or does it seem like these access points are really focused kind of in this type of model?
Well, I wouldn't say that they're focused on just this type of model. I think much to the overall problem is the traditional models are all based on volume, very little on value. And so when you're faced with that, the tools might be there. So your primary care physician will probably tell you they have a portal, they have virtual visits, things like that. But a lot of times they don't utilize them. They want you to come in the office. That's where they get most of their reimbursements, as a face-to-face. So in these models, like direct primary care, such as Paladina and Activate, you just get to actually use all the tools at your fingertips. So virtual visits can be great, and you speak straight with your provider or a doctor that you're familiar with. And so really it just comes down to slowing down and being able to provide care the way that it's supposed to be provided, and having the time and tools at your fingertips to do what you need to do.
Yeah, I appreciate that. So it seems like all of this ties really back at the end of the day to patient engagement. And JP, I'm just interested in your perspective. I know Activate has both on-site and near-site clinics. How do you really see access and engagement playing together?
Each group is different. So we talked earlier about it's not a one-size-fits-all. That certainly applies in the clinic setting as well. So really understanding what are the healthcare drivers for each organization that you serve, and how do we best address those. And for some groups, that is an on-site dedicated clinic at the facility where we integrate occupational health, for example. For others, it might be a near-site clinic that can be shared with multiple employer groups that provides greater access to spouses and dependents. Many groups, more than half of the healthcare spend for the population is being driven by spouses. So it's very important to get engagement within that segment of the population as well. So we take a look at census information. We really encourage clients to look at making it easy for the entire family to access. So we look at where people live, if they're wanting to do a near-site clinic versus where they work. So again, it's really tailoring the experience to the client that we're serving to best drive the overall utilization of that particular population.
Great, thanks for that. So we've talked about funding models, we've talked about personalized care, and we've talked about access, but at the end of the day, we got to have the data to make the right decisions and to show the value that we have. So I think the last thing we want to touch on here is both population health and data utilization, and how we use those to improve access to care and deliver a better experience at less cost. So JP, I'm going to go back to you. Could you provide a few examples of the health data that you're collecting and that you're sharing with employers?
Yeah, and this is a critical piece. So, a clinic model is not cheap. So our clients expect a return or value for the investment that they're making, and so providing data on outcomes and what we're doing to improve the health of their population is critical. And so we do that by integrating medical and pharmacy claims data from the carrier TPA directly into our EMR and data analytics platform. And then we marry that up with the clinic encounter data that we see, from patients coming in through the clinic. And we can provide a host of reporting capabilities, not only to the employers so they can see the value that they're getting and the results that we're achieving for their population, but also it allows our providers to kind of see the whole picture for patients. By getting that claims data, we can see what else is going on outside of the clinic, identify gaps in care if we're trying to manage a chronic patient and there are specific benchmarks that they need to hit throughout the year to be compliant. We can see through the data whether any gaps exist, and if they do, then we can proactively work with the patient to get those closed, either reaching out to the patient to get them into the clinic, or when we have them there in the clinic, address those gaps at that point in time. So it's really, we use data both to communicate with our clients, but also our providers utilize it as well every day.
Yeah, that's great. So Kim, one of the things JP just touched on is that the providers use that data on a daily basis. And I feel like you mentioned Paladina Health has a similar process through a daily care opportunity or a type of report. Can you tell us a little bit about how that works?
Yeah, so much like the Activate model, Paladina really relies heavily on data analytics and the intake of medical and pharmacy claims. And the essence of it is that before a patient comes in, we provide our physicians with sort of all of this background data in a one-pager that helps the physician change any visit from an acute one into a proactive one. So an example would be, let's say someone comes in because they've got back pain or they feel like they have strep or something. At the physician's fingertips, they're going to be able to see, oh, you know what, I need to talk to you about your colonoscopy screening and how is it going with, the weight loss plan that we were doing or all of that. So it's the opportunity when we have that captive attention with the patient in front of the physician to really take a global look at where they are in their health, if they need screenings, etc. The power of data cannot be understated when we're treating the whole patient and really the whole population. And so it goes from the individual to a model like Activate's and Paladina's to be able to take a look at the population as a whole and what gaps there are with outcomes.
Yeah, appreciate that. So Tony, in your role, how are you seeing the need for and the utilization of both data and population health kind of play out across your book of business?
I'm being repetitive here. It goes back to the foundation is time. You might have the data in all your models, but does anybody have the time to use that data in traditional models? And the answer is probably not. With the implementation of EMR systems, we thought that would help with data. There's a lot of alerts and things like that happen. But when you don't have the time and it's all about speed, you can't pay attention to the data. So in these direct primary care models, these on-site, near-site clinics, you get to have the time to review the reports that Kim is referencing and that JP is referencing, and you get to actually analyze what you need to do for the patient, which is just, something you can't do in the traditional model and makes a huge impact in the outcomes.
Mm-hmm. Yeah, absolutely. That's great. Well, I'm glad to see that the data utilization is continuing to expand. I think it's gonna make an even bigger impact as innovation in the healthcare space continues to unfold. So I wanted to read this stat. I think this is really impactful. 64% of Americans avoid or delay treatment due to the cost of medical care. And fortunately, value-based care models, I think, are really trying to address that head on, as we've seen through kind of the 4 creative cost strategies that we've just touched on. So I want to flip over and talk a little bit about what you, the experts, have to say on a couple of key areas. So first, I'm interested to know, what do employers really want? JP, I'll start with you.
Yeah, I think there's several things that employers are looking for. I think a measure of control over their healthcare spend that doesn't exist today when you're working with a carrier or a TPA. This type of model does give an employer some control on how their healthcare dollars are being spent. So that's one thing from a cost perspective. But from a people perspective, employers want to be attractive to potential quality employees, and they want to retain the quality employees that they have. So offering a benefits package that goes beyond just base salary and offers real true benefits to people is certainly something that's that employers are looking for. And offering free access to primary care is a huge benefit that's valued by employees and their family members. And we're seeing in some of the data from our clients significant reductions in turnover. That's a cost that we're not measuring in our ROIs, but it's real and it's there. And so I think employers want to stay in private healthcare, and they're looking for solutions to make it viable over the long term. And many have recognized that direct primary care or employer-sponsored primary care clinics are one way to do that. Yeah,
appreciate that insight. Tony, can you give us your perspective on that from kind of the broker consultant world?
Yeah, I mean, I think employers are, just like everyday people, they want to feel like you're listening to them. And so I think that's a big factor in direct primary care. Just like any business, if I just have a product and I put it out there and say, take it or leave it, you will get some business, but maybe not all of it. In this model, in this direct primary care model, employers just want to feel like you're sitting at the table, listening to them, and together partnering to come up with a solution that works for both parties, and really a kind of a VIP treatment.
Got it. Kim, what are your thoughts?
I would say it's really a big question and dependent on the workforce, but a couple of points. To echo JP's mentioning recruitment and retention, I also believe that the workforce is changing and really demanding a level of paternalism that we haven't seen perhaps before. And so that sort of addresses that, even to Tony's point about them feeling special, people feeling special and heard and listened to, even at the employee and the employee/patient level. I also believe that employers today are investing more in their employees, as they're the people taking care of their customers and their clients.
Yeah.
And so being able to offer a benefit that takes care of the employee in this way is very rewarding, and pays great dividends, I believe. I guess they want what we all want as consumers: high value, median cost, and to people to use the programs that they're buying. Like they're paying for all of these things extra. Like let's make sure that the utilization is maximized there, and really putting all those things together, especially with the model like Activates or Paladina's, it will start to control costs, the empowerment of the patient and the individual.
Yeah, that's great. Feels like we're headed in the right direction. Second, I'm interested to know from your perspectives, what's worth getting excited about? Tony, can you tell us a bit about that?
Sure. I mean, I just think the space in general is exciting, very innovative. You know, when you sit at the table with these employers and talk about everything, you start coming up with creative ways to try things. And for example, I've worked with a few employers that actually had teaching kitchens or nutrition classes for the employees to help them learn, you know, what is the cause of all their healthcare problems. And a lot of times it's the food we're putting in our body. So just things like that. We're in a very innovative time, and it's exciting.
That's great. JP, what's your perspective?
I think there, along those same lines that Tony's mentioned, I mean, we're learning a lot about what the needs are of our clients and can offer additional services beyond just your traditional primary care. I mean, we're starting to get into behavioral health offerings through the clinic, which is a huge issue in America today, just access to quality behavioral health services. So, you know, getting into those types of areas. We have one clinic in California that's offering dental services, and we put a dental chair in the clinic. So starting to branch out beyond just, you know, your core traditional primary care services is exciting. And I think it's also exciting to see some of the results that we're getting. People do kind of inherently want to be healthy, and when given the opportunity to do so, they take advantage of it. And so I think if from an employer perspective, I would be excited that, hey, there are some answers out here to get people on the right track and make things sustainable over the long term.
Yeah, that's great. So last but not least, let's talk quickly, what does the future of healthcare look like? Tony, I'll have you start out there.
Well, I think you're going to continue to see the growth of direct contracting, whether that be on-site clinics, near-site clinics, shared models, or even direct contracts with your primary care providers, or ancillary services like PT or imaging. But I think you're going to continue to see this model grow and expand because it is starting to show some promise on outcomes and trend change. And ultimately that's where it starts is, you know, can we curb the trend?
Mm-hmm. Kim, what do you think? Where's the future of healthcare headed?
I think the old school is going to be the new school, honestly. At the end of the day, whether it's the carrot or a stick approach in an employer sponsored plan, like the employee must engage in their own health.
Yeah.
And employers, network partners, carrier partners who engage those strategies that empower towards outcomes, improved health outcomes, improved mental health outcomes, will have the best chance at mitigating cost. And so I think it's just going to kind of swing back to engaging how to effectively engage the patient in their own health.
Mm-hmm. Yeah, JP, what do you think?
Yeah, I mean, it's honestly, I think it's a fairly difficult question to answer given the current political environment and upcoming election and very different philosophies on different sides of the aisle of how to tackle healthcare. So that complicates things tremendously. But I think, you know, you've got to look beyond, you know, kind of what we're doing in clinics and employee benefits and look at certain initiatives. I saw in 60 Minutes recently, the NYU Medical School has just recently announced that going forward, anybody who is accepted and enrolled as a med student, there's no tuition. They've built their endowment up to a point where they can offer free tuition to anyone who's enrolled. And where that comes into play is, you know, looking into the future, there is going to be a significant shortage of primary care. There already is one. And if you can eliminate the debt load that future doctors are going to have, that will encourage people to get into primary care or other areas of healthcare that aren't high-level specialties, because they'll have a future that's more flexible without a huge debt burden. And so it's going to take a number of creative, innovative initiatives like that to kind of stem the tide. And back to Kim's point, to create an environment, a system where people can engage in their health at a deep level. And so it's all kind of connected, but I mean, I think we'll continue to see innovative ideas and strategies, and because it's something that has to get solved. It's the sustainability of the country, quite frankly.
Yeah, great. Thanks everybody for weighing in on that. So just to wrap up with some key insights here, I think first, a single point of care for up to 90% of care needs really improves the quality of care and convenience of accessing services. Second, seems like employer-direct healthcare is going to continue to grow. We're going to see more of this in the healthcare space as these innovative solutions emerge. And third, employers who create strategies that empower their employees are really going to have the best chance of mitigating costs. So it's important to look towards partners who can help facilitate that innovation and that empowerment. Well, I want to thank everybody for watching this webinar. I also want to take a minute to thank our presenters for being with us today. If you guys have any follow-up questions, feel free to contact us through the below emails with each person here, and look forward to working with you to continue changing healthcare for good.